Travel in the U.S. gets a yellow light today as the CDC releases new guidelines for people who are fully vaccinated. Here to answer your questions is Dr. Robert Finberg, which means it's Friday, professor of medicine at UMass Medical School in Worcester. Doctor, thank you so much always for joining us. We do appreciate it. CDC says people who have received both doses, are at low risk for infection when they travel, but the agency is still discouraging trips because of the rise in new cases that are happening all around the country. So what else do you want people to know before they go anywhere?
I think people should know that there are variants, and these variants are localized to some communities and not others. And the risk is that we'll spread a variant from a community that has it to a community that doesn't have it. That's something we don't want to do.
Can I quickly just ask you, is that what's causing the rise in these numbers? Is it the variants or is it COVID-19? Or have we not determined that yet?
You know, there's a lot about this virus that we don't know, and the virus isn't divulging. So,
okay.
I can't tell you.
Great answer.
Virus isn't
I'll stop
divulging.
asking for now.
Well, we've talked about the variants, Doctor, for a while now. So the more contagious and possibly more deadly UK variant has been identified in virtually all 50 states, in 49. So some experts think that governors should postpone second doses in their states a little longer so you can get that first dose, at least one dose into more people. You sit on the state's vaccine advisory board here in Massachusetts. Is that something that you would push Governor Baker to do?
So that's a complex question and something that there's no easy answer to and a lot of debate about. We don't really know, again, the best way to prevent the spread of variants. The CDC has taken the position that we should give the vaccines in the way they were studied, and we're currently following their lead. I think the most important thing is that people should go out when they're eligible and get a vaccine.
So, unfortunately, we've been reporting all week the number of local communities are at high risk. They're in the red again for infection. That's more than doubled since even last week. 55 cities and towns in that zone. So is there anything new that anybody can do to bring those numbers down? Or is this just the cycle of it?
Well, we know that getting vaccines does prevent disease. We urge everyone to get the vaccine who's eligible. We also know that avoiding large crowds, the masks, social distancing, and hand washing will prevent spread of the virus. So we still recommend all of those things.
We know that 55 cities and towns are in the red, but we know Massachusetts has 351 cities and towns, so the larger number or not. But those are all great points. On Monday, more residents in Massachusetts will become eligible for shots. The new group includes adults 55 and older, people 16 and older with what we call comorbidity. So there are new additions to that list. What are they?
Well, they include type 1 diabetes, formerly it was just type 2, lung diseases, including moderate to severe asthma, liver disease, HIV infection, also stroke, dementia, and other neurological diseases, as well as substance abuse and obesity.
And overweight is the word that they were using. What's the difference between overweight and obesity? Is it the same?
No. Overweight is described as a body mass index of greater than 25. Obesity is a body mass index greater than 30.
Dr. Finberg, thank you so much for your
Thank you, doctor. Stay well. Good to see you.
Thank you.
Have a wonderful weekend. Take care.